Hello, this is the beginning of my persuasive speech, and this is my crowd. Okay, so I'd like to begin with telling you about the stories of Mario Monicelli and Lucia Magri. Uh, Mario Monicelli actually is an Italian world-renowned film director who ended up actually committing suicide in 2010. It was actually he was diagnosed with a personal physical or and mental illness of extreme depression, and actually becoming perpetually bedridden, he decided to take his own life by leaping from the hospital room. So, in contrast to that, actually, is the Lucio Magri. He is also Italian, but a well-known left-wing intellectual. He ended up passing away a year later after that, but it was simply by the same kind of mental diagnosis. He was fighting the same kind of extreme depressions, but he ended up actually, rather than doing it in such a crude manner, he decided to go to Switzerland and pursue a physician's assisted suicide and did it in a more humane manner. They both had the same kind of mental illness, they fought the same battles, but he ended up actually, in my mind, taking the more humane approach to this idea. For the mentally ill, actually unresponsive to these treatments that is constantly offered to people, it's the mental distortion for them that they should be known about. It's something that it's their own form of normality. That's the way they see things, and it should be considered a little bit more humane that they can make these possible decisions. I myself have actually witnessed, as a cancer patient, a lot of the idealisms that quality of life is actually more and more important than quantity of it. So, in that idealism, I have actually researched the mandatory psychiatric assessments behind physician-assisted suicide, written by Dr. Brendan Kelly in 2002. That was actually following a year later after Dutch Euthanasia Act was passed for the legalization of physician-assisted suicide. On top of that, I actually also read the medical journal written by Dr. Rosanna Secchi, who that she's the one that wrote about the two Italian gentlemen that I talked to and opened with. On top of this one, I also researched Nancy Melville's article, Assisted Suicide for the Mental Illness Gaining Ground. And that is an interesting article because it actually presents the idealisms that by actively turning people down with mental illness, it actually increases the ratio and shows that people are much more prone to go more towards the option of crude suicide, just like Mario Monticelli did. And she also shows that by offering the options of a physician's assisted suicide, it is a more humane option. And ultimately, it actually shows that a lot of people end up turning it down simply by just knowing that they have that ability to make an option. And mental deficiency is hard for many people to truly understand. So that one option actually kind of becomes very important to them. So, on that note, I'd like to review my topics here. Following psychiatric analysis, physicians assisted suicide should be considered humane for the mentally ill. My second topic being that rights are mainly only given to the mentally sound because suicide is actually considered a mental deficiency. The option of suicide as my third is it often gives the mentally ill reason to live. So it isn't actually the counter intuitive thing for these folks. So I would like to begin then with my first topic. Following psychiatric analysis, physician-assisted suicide should be considered more humane for the mentally ill. On that notion is actually an interesting article that I read. It was written by Dr. Rosanna Secchi, and she herself actually wrote that by assessing that suicide itself as an expression of mental illness, classifying it as pathological, in turn means that the desire to commit suicide is invariably an expression of an inability to make a decision. Um, it's an interesting way of looking at things because it sort of excludes the idealisms that rational suicide is actually considered ethically appropriate in different cultures. Um, in support of all this as well is Dr. Ava Bolt's survey that she committed at the Amsterdam Public Health Research Institute. She interviewed and sent out a survey to 1,500 different practitioners, and she asked which would actually consider the option of assisting suicide for patients. And 80% of them said that they would for cancer patients or anybody else with a physical illness that's probably quite terminal for them. Only 30% actually responded that they would consider it for the mentally ill. Um, it's an unfortunate kind of truth, but researchers at Radboud University and Medical Center actually determined that in this idealisms that our current definition of unbearable suffering for people is quite loose and doesn't really have much boundaries. So it leaves it as a very difficult doctoral analysis to define exactly what that truly is. In support of all that as well is New York Times published for America that we are recently within the highest rate of suicide within the last 30 years. So that basically proves that we're both inappropriately and inefficiently approaching the manner of suicide for both the mentally sound and the mentally ill. So that does need to be reapproached. It needs to be looked at a lot differently. Um, our second topic here is the rights that are mainly given to the mentally sound because suicide is considered a mental deficiency. That's the difficult thing, but Jane Collingwood actually reveals in her article that only about 30% would consider that suicide with the mentally ill, as I previously mentioned. Of those, it's actually only about 40% that would consider it with patients with dementia. And that is the unfortunate mental illness because that is an endless and terrible form of torture for somebody. And such a low ratio actually would consider that. And that kind of basically shows exactly where we're at with those idealisms as far as who is suffering with those unbearable levels of suffering. In America, in contrast, though, we actually only have 6 states who would actually consider the physician's assisted suicide. But it's mainly only just for the folks who are terminally physically ill. And we have that in California, Colorado, Oregon, Vermont, and Washington. On top of that is the 6th state, which is Montana, but that is actually only something that will come through if it is gone through a court process. It has to be shown that it within a court that it is an actual reasonable situation, whereas in the other prior mentioned 5 states, that's between the doctor and the patient, and then it usually involves a peer review as well, so they can then mutually determine if this is a admissible option for this patient. Dr. Ava Bolt actually reveals that the 80% of the patients interviewed would consider the physician-assisted suicide for those in an untreatable physical disease. Um, that's the interesting thing because the option of suicide often gives the mentally ill reason to live. So it's an interesting contrast with that idealism because there is a growing level of research showing that there is a biological connection to mental illness these days. It's a small front at the moment, but it is growing. So it does show that there is an actual biological basis, thus meaning that it is a physical illness as well, which could then fully relate to the other people that would only do it for a physical terminal illness. Something also growing in that research is the fact that it's somewhat discriminatory than to actually deny a patient the option of a physician-assisted suicide purely on the basis that it's a psychiatric illness, whereas it can be connected to a possible biological basis. So it's kind of interesting, but it just shows a little bit further also with Nancy Melville's article of assisted suicide for the mentally illness gaining grounds that most mental illness patients actually just want to know that they have at least one more remaining choice in this world. They just want to know that they can actually make these kind of decisions. She revealed that out of a possible, it was about, I think, 75 patients that did approach a doctor with a desire to end their life, it was roughly about 60 or so that did end up going through, but those were patients that mainly just had physical disease that truly could not get out of those. But out of those remaining, it was roughly about 13, 8 of them. Well, out of the entire 13, there was all the mental illness, but out of those 13, 8 of them actually ultimately turned down the option once they were finally recognized and given a little bit of respect for the decision that they wanted to make. So it was rather interesting that just by giving them that option, that it was a higher percentage of that 8 out of 13 that decided to ultimately live. They just wanted to know that they could possibly have that option. John Cutcliffe actually further supports that in his article that by giving a mentally ill patient the option right at the end of their own life may in fact turn the decision around as being the only option for them in adaptation. It's a possible way of them to see their own world in a rational sense. So, with all this in mind, I have spoken to you about my 3 points about assisted suicide as a rational option for these patients. It's a better way of looking at things for people. It offers them an option. It offers them a decision to make in their own given life. Following the psychiatric analysis, I think then physician-assisted suicide should be considered humane for the mentally ill. It makes rational sense for these people to make that option. Rights are mainly only given to the mentally sound these days because the suicide is considered a mental deficiency in of itself. But I think that is in itself actually gaining ground on this biological basis connection. The option of suicide often gives mentally ill reason to live. And that is the truly amazing part of the research that I found, because putting patients through a swamp of pharmacotherapy just doesn't seem rational for them. It just does not seem like a formal way to live if they are cognitively available and they're willing to try any given treatments that are available to the public, to anybody, and they're willing to try basically anything, but nothing is possibly working. It just doesn't make sense to then let them just continue to suffer. If they want to then finally make that final option, it should be given. It just seems plausible to them and to me really. In my studies completed by Brendan Kelly, Nancy Melville, and Dr. Rosanna Secchi, they all basically prove that by denying this option to people, that it actually does increase the ratio of suicide, and it's a much more crude manner. It's a terrible way to go, but it also shows that by giving this option to the people, that a greater percentage of them actually then ultimately turn it down because they just want to know that they have a choice, which then invariably changes their ultimate perception of life, and then wanting to continue it. So that is my speech, and I appreciate you guys listening. Yes, you can clap. Thank you guys.